Many people today say that we're in the middle of a mental health crisis. Or perhaps a better way to phrase that, at least today, would be to say that we're in a mental health epidemic. Depression is now the #1 leading cause of disability worldwide, and over 300 million people suffer from depression across the globe. Now, I find numbers like that quite difficult to comprehend, so let me put it into context when I say that's roughly the population of the United States. Suicide is now the leading cause of death for men under the age of 45, at least in the UK, and up to 50% of people don't respond to the antidepressants prescribed to them. Research into new ways of treating mental health problems has slowed since the turn of the millennium, and many of the new drug treatments that we do have are just alternative versions of pre-existing treatments. Now, actually, at this point in the talk, when I was writing the script, I was going to say we desperately need new treatments, which may well be true, but that's not what I'm going to talk to you about today. What I'm going to talk to you about is actually quite an old treatment. It's called ayahuasca, and it's a psychedelic plant brew from the Amazon rainforest. And I want to discuss with you whether or not it could and should be used to treat our current mental health crisis. My name is Dr. Simon Ruffell, and I'm a psychiatrist and a researcher currently based here in London. In 2016, I decided to take a break from working for the NHS. I've been working in psychiatry for a couple of years, and I was beginning to get a bit dismayed about the way that we were treating our patients. Specifically, many of them seem to come back time and time again, so much so that we actually have a term for that. We call it the revolving door syndrome. And so I decided to take a break from medicine, and I traveled to Central America. And when I was in Guatemala, I actually found myself in a cafe sitting next to somebody who was training to be a shaman. Now, a shaman is a type of traditional healer who can work with plant medicine, but also primarily does their work in the spirit world. We're roughly the same age and grade, me in Western medicine, and him in Amazonian plant medicine. And he told me these amazing stories of the ways that he used something called ayahuasca to treat his patients, treating many of the conditions that I've been struggling to treat in the hospitals back home. And so when he invited me to come with him to the Peruvian Amazon, I said yes. So, just a little bit about what ayahuasca actually is. Very simply put, it's a mix of two different plants. It's a psychedelic plant brew, and one of those plants contains the very potent hallucinogenic DMT, or dimethyltryptamine. It forms this thick black liquid, which is really disgusting to drink, but if you do manage to drink it, then you get this intense psychedelic experience. Some people have differences in their perception. They can see or hear things that other people can't see or hear. And other people have changes to their thought patterns. They can think about things in a more objective way, sometimes reliving old memories from their childhood. Ayahuasca is being used by some indigenous communities for hundreds of years, but probably much longer, and it's used as a medicine and a sacrament, although historically it was used for warfare and for witchcraft. And some people even believe that when you drink ayahuasca, you can connect to intelligent entities not visible in this dimension. And so I traveled down to the Peruvian Amazon with my newly made friend who was training to be a shaman, and I found myself in an area called the Mashana community. This is a community made up of 70 indigenous individuals, and it was here that I had my first experience drinking ayahuasca in a ceremony. So ayahuasca ceremonies, at least according to the Shipibo tradition, take place at night. They last for around 6 hours, and they take place in a wooden structure called a maloca. This is a circular building, and the participants, around 8 to 10, sit around the outside. Each participant has a mattress and a pillow and a bucket. Now, the bucket is for something called the purge. Now, ayahuasca quite famously can make you vomit, and that can be really, really intense, but it's not just vomiting up things. It can be a purge of emotion. Some people laugh and cry. They might be shivering and shaking. And for other people, they just get diarrhea. So it can pretty much be anything, really. And everyone drinks the ayahuasca, including the shaman, who's seated in the middle of the circle. And when the shaman starts to feel the effects of the ayahuasca, they start to sing these traditional healing songs called icaros. Now, these songs, according to the Shipibo tradition, allow the shaman to connect to spirits from the plant kingdom. And when they do this, they can heal the participants through energy. Now, I was completely blown away by the effects that ayahuasca had both on myself and with the other participants that I was drinking with. Specifically, how quickly it affected me. I felt really different almost immediately after the ceremony. And so I started looking at the research that had been done into ayahuasca, and much to my surprise, I found there was a bit of a gap in the literature, at least looking at ayahuasca in the Peruvian Amazon in retreat centers. And so I excitedly called my colleagues back in the UK and I told them about the experience that I'd had. And within 6 months, we were back in the Amazon rainforest conducting our first study looking at ayahuasca and personality. This study suggested that ayahuasca could help people with anxiety, both in the short term and 6 months later. That was quite unsurprising, and nobody actually wanted to fund this research when we first started, so we actually self-funded that first project. But fortunately, on the back of that, we did get some funding from the UK government, and we were able to start looking at more common mental health conditions, such as depression and traumatic memories from childhood. And we found that ayahuasca might be effective in helping people with these things too. At the same time, other researchers from around the world were beginning to look at conditions such as addiction and panic disorder, also finding that ayahuasca could be effective helping these things as well. Other researchers started looking at brain scans and found that ayahuasca could change the way in which the brain was functioning, allowing different parts to communicate and connect that didn't normally do so. It seemed that ayahuasca could break these repetitive cycles that people so often find themselves getting stuck in when they suffer from depression and anxiety. Maybe even tackling the root cause of the problems rather than just symptom management, like so many of our drug treatments in the West. We started looking at the biological effects of ayahuasca, conducting the first study ever to look at any psychedelic and its effects on DNA. And the more I was doing this research, and the more it was taking more of my time and it was becoming my primary focus, I found that I was getting asked time and time again, why? Why do all of this research into ayahuasca? I definitely found it interesting, absolutely fascinating. And I really thought it could help people, at least that's what I was seeing. But if I'm being completely honest, when we first started, I had this idea that I might be able to help legitimize indigenous traditions like the Shipibos. But then as time went on, I realized that that's actually a really Western way of thinking. Pretty naive, and if I'm being completely honest, really rather arrogant. Why would the Shipibos or any other tradition need me or anyone else to legitimize the work that they were doing? There's certainly a type of person who goes to drink ayahuasca in the Amazon rainforest. And there are many barriers to getting there, such as money and getting time off work. Plus, it's not everyone's cup of tea to go and drink a potent psychedelic in the middle of the Amazon rainforest with a shaman. And so that led me to think, where do we go from here? In 2021, I started working for an organization called the Psyche Institute. This is a not-for-profit that aims to develop psychedelic therapies as registered medical treatments. And this involves looking at ayahuasca in a clinical setting, conducting studies in labs, and this opens up the possibility that ayahuasca could be prescribed in the future by medical doctors. Now, obviously, for both me and my colleagues, this raised a whole host of questions that have to be carefully considered. Questions such as, is it ethical to take a tradition from the Amazon rainforest and to try and fit it into a Western clinical setting? Could it actually help people? I believe that it could. And will it actually work? Now, this one's particularly interesting because ayahuasca works in different ways depending on the lens through which you view it. So, from a Western point of view, some of the chemicals in ayahuasca can affect some of the receptors in our brain, like the serotonin receptors, much in the same way that the antidepressants we already have do. But from a Shipibo point of view, or an indigenous point of view, they wouldn't necessarily disagree with that, but they would say you're missing the point. It's the ceremony that's the important part, and it's the connection to spirit that causes the healing. And if you don't have that, then what do you have? I mean, it's just a bunch of chemicals, really. This, of course, is no easy task, and what we're talking about is trying to translate an ancient tradition into a Western paradigm. I don't think the hospitals or the NHS are going to be running ayahuasca ceremonies anytime soon, and to be honest, maybe they shouldn't be. So, how do we do this in the correct way, if there is a correct way? I'm not coming here today saying that I have all of the answers to these questions. But what I do know is that research into psychedelics has ignited over the last decade. Early stage research looks extremely promising, leading many to ask the question, could psychedelics fill a long-standing treatment gap in psychiatry? There are definitely issues to do with hype, and the media have got behind psychedelics, suggesting that it might be some magic bullet that's going to save all our problems, and I think that's dangerous. But it is looking very likely that we're going to see psilocybin, which is magic mushrooms, and MDMA and ecstasy pills legalized for treatment in the upcoming years. Whether you agree with it or not, ayahuasca is spreading across the globe. It's now present in every continent, and it's available in many different forms. And so I think the question that we need to be asking realistically is, what can we do to make this spread ethical? I believe that this can be done through listening. Can we listen to and work with the communities who use plant medicines, supporting them and giving back to them rather than just extracting like we have done so often in the past? Can we respect these traditions whilst allowing for adaptation in a safe and an effective way? And can we listen to the experts as we try to learn medicine from a different paradigm? I believe that this is possible. And if we can do this, then maybe ayahuasca will help us with the global mental health crisis. I'd like to say a big thank you to the Lopez brothers, who are the curanderos we work with in the Amazon rainforest, and also to Carlos Tanner and the Ayahuasca Foundation for making this possible.